How to pass the phlebotomy exam first try. Question 1. What should a phlebotomist do if they notice that the expiration date on a vacuum collection tube has passed? Option A. Use the tube anyway if it is the only one available on the tray. Option B. Discard the expired tube and select a current, unexpired tube from inventory. Option C. Assume the additive inside is still functional for another 6 months. Option D. Write the current date over the expiration date on the label. The correct answer is option B. Discard the expired tube and select a current, unexpired tube from inventory. Expired vacuum tubes may have reduced vacuum, degraded additives, or compromised sterility. They should be discarded and replaced with unexpired tubes from inventory. Using an expired tube can cause short draws, clotting, contamination, or inaccurate results. Question 2. What is the primary medical reason for avoiding the basilic vein for routine venipuncture procedures whenever possible? Option A. The vein is too small to yield an adequate sample volume. Option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. Option C. The vein has a high tendency to collapse under normal vacuum tube pressure. Option D. The vein lacks a sufficient path to the superior vena cava system. The correct answer is option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. The basilic vein is avoided for routine draws because it lies close to the brachial artery and median nerve. Injury in that area can cause significant bleeding or nerve symptoms. Safer veins should be selected first whenever they are available. Question 3. Which of the following options defines the proper site for performing a venipuncture on a patient's hand? Option A. The ventral aspect of the wrist near the radial artery. Option B. The dorsal aspect of the hand, focusing on the dorsal venous network. Option C. The inside aspect of the thumb pathway. Option D. The lateral borders of the palm. The correct answer is option B. The dorsal aspect of the hand, focusing on the dorsal venous network. Hand venipuncture is performed on the dorsal venous network on the back of the hand. These veins are superficial and require careful anchoring and a shallow angle. The palm, wrist, or underside of the hand carries more risk and is not preferred. Question 4. Which of the following parameters can cause a false decrease in glycolysis tracking within a serum specimen? Option A. Leaving the serum in contact with the red blood cells for longer than 2 hours. Option B. Chilling the specimen on ice immediately after collection. Option C. Protecting the specimen from exposure to room lights. Option D. Mixing the tube gently 5 times right after the draw. The correct answer is option A. Leaving the serum in contact with the red blood cells for longer than 2 hours. Glucose decreases when unseparated blood remains at room temperature because cells continue glycolysis. Serum left in contact with red cells for more than 2 hours can therefore show falsely low glucose. Prompt separation or use of a glycolysis inhibitor helps preserve the result. Question 5. Which of the following practices is critical to perform when collecting a specimen for a cold agglutinin test? Option A. Keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Option B. Chill the tube in an ice slurry immediately after drawing. Option C. Protect the specimen from light by wrapping it in heavy foil. Option D. Centrifuge the tube immediately within 2 minutes of collection. The correct answer is option A. Keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Cold agglutinin specimens must be collected and kept warm at about 37 degrees Celsius. Cooling can cause antibody-mediated red cell agglutination before testing and distort results. Pre-warmed tubes and warm transport preserve the specimen condition needed by the laboratory. Question 6. Which of the following tubes is typically selected for a zinc, copper, or trace element determination? Option A. Royal blue top tube. Option B. Lavender top tube. Option C. Light blue top tube. Option D. Grey top tube. The correct answer is option A. Royal blue top tube. Royal blue top tubes are designed for trace element testing such as zinc and copper. They minimize contamination from tube components that could falsely elevate trace metal results. Routine additive tubes are not manufactured to the same low contamination standards. Question 7. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A, 70% isopropyl alcohol alone. Option B, chlorhexidine gluconate or tincture of iodine. Option C, sterile saline solution. Option D, benzalkonium chloride. The correct answer is option B, chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 8. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A, gently advance or pull back the needle slightly to ensure it is in the lumen. Option B, remove the needle completely and start over on the other arm. Option C, leave the tube in place for 3 minutes to allow the vacuum to recover. Option D, push the needle deeper at a 90-degree angle. The correct answer is option A, gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 9. What does the acronym PASS stand for in relation to fire extinguisher operation? Option A, pull, aim, squeeze, sweep. Option B, push, aim, slice, secure. Option C, pull, activate, squeeze, shake. Option D, press, aim, secure, sweep. The correct answer is option A, pull, aim, squeeze, sweep. PASS stands for pull, aim, squeeze, and sweep. This sequence describes the basic operation of a portable fire extinguisher. Using the wrong sequence can waste time and reduce effectiveness during a small controllable fire. Question 10. What is the correct clinical action for selecting a puncture site on an arm that has an active intravenous 4 line? Option A, draw from a site distal to below the 4 line to minimize fluid contamination. Option B, draw directly above the 4 line insertion site. Option C, adjust the 4 flow rate to run faster during the draw. Option D, draw from the 4 line without flushing it first. The correct answer is option A, draw from a site distal to below the 4 line to minimize fluid contamination. The fluids can dilute or contaminate specimens collected near the infusion source. When collection from an forearm is unavoidable and allowed by policy, a site below the 4 is selected with appropriate coordination. The opposite arm remains preferred because it avoids infusion-related interference. Question 11. Which of the following conditions can cause a specimen's serum to appear bright red or pink after centrifugation? Option A, lichemia. Option B, icterus. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option C, hemolysis. Hemolysis releases hemoglobin from red cells and gives serum or plasma a red to pink color after centrifugation. It can also falsely alter potassium, LDH, ASD, and other analytes. Lichemia appears milky, and icterus appears yellow to amber. Question 12. Which of the following tests evaluated the intrinsic pathway of the coagulation cascade and is used to monitor heparin therapy? Option A, prothrombin time, patient. Option B, activated partial thromboplastin time, APTT. Option C, bleeding time test. Option D, fibrin degradation products, FDP. The correct answer is option B, activated partial thromboplastin time, APTT. APTT evaluates the intrinsic and common coagulation pathways and is used to monitor unfractionated heparin therapy. Heparin prolongs clotting activity measured by this test. Patient and INR are more associated with warfarin and the extrinsic pathway. Question 13. Which of the following veins is located on the outer thumb side of the arm and is the third choice for venipuncture? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option A, cephalic vein. The cephalic vein lies on the lateral, thumb side of the arm and is often a later choice for venipuncture. It may be more difficult to anchor and access than the median cubital vein. The basilic vein is medial and carries greater nerve and artery risk. Question 14. What is the primary purpose of the laboratory's safety data sheets, SDS? Option A. To track the daily attendance and performance records of employees. Option B. To provide detailed information regarding chemical hazards, handling, and first aid measures. Option C. To schedule the preventative maintenance routines for centrifuge machines. Option D. To log the critical panic values reported to physicians. The correct answer is option B. To provide detailed information regarding chemical hazards, handling, and first aid measures. Safety data sheets provide essential information about chemical hazards, safe handling, storage, spill response, and first aid. They support employee safety and emergency response in the laboratory. They do not track attendance, equipment schedules, or critical value reporting. Question 15. What is the target population for a Guthrie card or newborn screening test panel? Option A. Geriatric outpatients in nursing homes. Option B. Infants up to a few days or weeks old. Option C. Pregnant women in their first trimester. Option D. Patients undergoing active chemotherapy treatments. The correct answer is option B. Infants up to a few days or weeks old. Guthrie cards and newborn screening panels are designed for infants shortly after birth. They screen for metabolic, endocrine, and genetic conditions that benefit from early detection. Adult, prenatal, or oncology testing uses different screening methods. Question 16. Which of the following options defines the proper site for an adult capillary puncture? Option A. The thumb or index finger of the dominant hand. Option B. The lateral or medial plantar surface of the heel. Option C. The palmar surface of the distal segment of the middle or ring finger. Option D. The side of the pinky finger near the cuticle. The correct answer is option C. The palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 17. Which of the following conditions can cause a specimen to appear cloudy, milky, or white after centrifugation? Option A. Extensive hemolysis from using a small gauge needle. Option B. Lipemia caused by high concentrations of lipids or fats in the blood sample. Option C. Icterus caused by elevated levels of circulating bilirubin molecules. Option D. Failure to invert an additive tube immediately after collection. The correct answer is option B. Lipemia caused by high concentrations of lipids or fats in the blood sample. Lipemia causes serum or plasma to appear cloudy, milky, or white because of high lipid concentration. It may result from non-fasting status or lipid metabolism disorders. Hemolysis and icterus cause red or yellow discoloration rather than milky turbidity. Question 18. What is the clinical term for small, red, pinpoint spots that appear on a patient's skin when a tourniquet is applied? Option A. Hematoma. Option B. Hemolysis. Option C. Petechia. Option D. Ichthyosis. The correct answer is option C. Petechia. Petechia are tiny red or purple pinpoint spots caused by small capillary hemorrhages. They may appear when a tourniquet is applied to a patient with fragile capillaries or platelet problems. A hematoma is a larger collection of blood, while ichthyosis refers to broader bruising. Question 19. Which of the following structures is an example of an unoxygenated blood carrier? Option A. Pulmonary vein. Option B. Aorta. Option C. Superior vena cava. Option D. Brachial artery. The correct answer is option C. Superior vena cava. The superior vena cava carries deoxygenated blood from the upper body back to the right atrium. Most systemic veins carry unoxygenated blood, while most systemic arteries carry oxygenated blood away from the heart. The pulmonary vein is an exception because it carries oxygenated blood to the left atrium. Question 20. What should a phlebotomist do if they accidentally puncture an artery during an attempted venipuncture? Option A. Complete the draw quickly and label the tube as venous blood. Option B. Remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. Option C. Leave the tourniquet tied tight to prevent a hematoma from forming. Option D. Instruct the patient to bend their arm firmly over a gauze pad. The correct answer is option B. Remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. An arterial puncture during venipuncture requires immediate needle removal and firm direct pressure for an extended period. Nursing staff or the provider should be notified because arterial bleeding can form a significant hematoma. Continuing the draw or applying light pressure is unsafe. Question 21. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A. Clear or plain red glass top. Option B. Light blue top. Option C. Lavender top. Option D. Light green top. The correct answer is option A. Clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 22. What is the primary function of the circulatory system's capillaries? Option A. Transporting blood under high pressure away from the ventricles. Option B. Permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Option C. Directing large units of blood directly into the vena cava pathways. Option D. Preventing the backflow of lymph fluid into the deep tissues. The correct answer is option B. Permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Capillaries are the exchange vessels of the circulatory system. Their thin walls permit transfer of oxygen, carbon dioxide, nutrients, and waste products between blood and tissues. Arteries and veins mainly transport blood to and from capillary beds. Question 23. What should a phlebotomist do if a patient states they have a history of severe syncope during blood draws? Option A. Perform the venipuncture while the patient is standing up to keep them alert. Option B. Place the patient in a recumbent, supine position on a bed or reclining chair before starting the draw. Option C. Tell the patient to close their eyes and hold their breath during the puncture. Option D. Request a doctor to administer general anesthesia before the draw. The correct answer is option B. Place the patient in a recumbent, supine position on a bed or reclining chair before starting the draw. A patient with a history of severe syncope should be positioned supine or reclined before collection. This reduces fall risk and supports circulation if fainting occurs. Standing or breath holding increases danger and should be avoided. Question 24. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A. Remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B. Tighten the tourniquet further to stop the spots from spreading. Option C. Ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D. Rub the skin surface firmly to see if the spots disappear. The correct answer is option A. Remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 25. For which of the following tests must a phlebotomist use a gray top tube containing potassium oxalate? Option A. Erythrocyte sedimentation rate, ESR. Option B. Oral glucose tolerance test, OGTT. Option C. Activated partial thromboplastin time, APTT. Option D. Blood urea nitrogen, BUN. The correct answer is option B. Oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses gray tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 26. Which of the following additives is used in a blood culture bottle to neutralize antibiotics circulating in the patient's blood? Option A, resin or activated charcoal particles. Option B, sodium polyant whole sulfonate, SPS. Option C, acid citrate dextrose, ACD. Option D, thixotropic gel barrier. The correct answer is option A, resin or activated charcoal particles. Resin or activated charcoal in blood culture bottles can bind or neutralize antibiotics present in the patient's blood. This improves recovery of organisms when the patient has already received antimicrobial therapy. The additive does not replace sterile collection technique or proper bottle filling. Question 27. Which of the following tubes contains the anticoagulant lithium heparin? Option A, light green top, PSD. Option B, dark blue top. Option C, yellow top. Option D, gray top. The correct answer is option A, light green top, PSD. Light green plasma separator tubes commonly contain lithium heparin and a gel barrier for chemistry testing. Heparin prevents clotting so plasma can be separated quickly after centrifugation. Other tube colors are used for trace metals, cultures, glucose preservation, or coagulation testing. Question 28. What should a phlebotomist do if an inpatient's door is closed and a sign states "No visitors, see nurse" before entering? Option A, knock loudly, open the door, and walk right in to maintain efficiency. Option B, locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Option C, skip the patient and come back at the end of the shift without checking in. Option D, call the patient's room phone from the hallway to ask if it is okay to enter. The correct answer is option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Assign directing staff to see the nurse may indicate isolation, safety, behavioral, or procedure restrictions. The phlebotomist should check with the assigned nurse before entering. Entering without clarification can endanger the patient, staff, or specimen collection process. Question 29. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option A, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm. The correct answer is option B, 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 30. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A, 70 to 99 mg/dl. Option B, 140 to 180 mg/dl. Option C, 200 to 250 mg/dl. Option D, 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 31. If a phlebotomist must use a syringe to collect blood, what device should be used to transfer the blood into vacuum tubes? Option A standard needle attached to the syringe puncturing the tube top directly. Option B, a syringe transfer device with a shrouded needle. Option C, pouring the blood from the syringe barrel after removing the stopper. Option D, injecting it through a butterfly needle set. The correct answer is option B, a syringe transfer device with a shrouded needle. A syringe transfer device allows blood to move safely from a syringe into vacuum tubes without exposing the needle. The device reduces needle stick risk and helps maintain tube vacuum and fill order. Removing stoppers, pouring blood, or puncturing stoppers with an exposed needle is unsafe. Question 32. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A. Draw the blood anyway and ask the patient to state their name. Option B. Look for the ID band on the nightstand or 4-pole and scan it. Option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D. Verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or 4-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 33. If a patient experiences syncope during a venipuncture, what should the phlebotomist do first? Option A. Call for an emergency code. Option B. Complete the current tube collection. Option C. Remove the tourniquet and needle immediately. Option D. Place a cold compress on the patient's forehead. The correct answer is option C. Remove the tourniquet and needle immediately. Syncope during venipuncture requires immediate protection from further injury. The tourniquet and needle should be removed first so bleeding and needle movement do not continue while the patient loses consciousness. Completing the tube collection is never the priority during a fainting episode. Question 34. What should a phlebotomist do if a patient begins to have a grand mal seizure during a venipuncture? Option A. Hold the needle steady inside the vein to complete the draw. Option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. Option C. Place a wooden tongue depressor inside the patient's mouth to protect their tongue. Option D. Restrain the patient's arms firmly against the draw chair to stop all movement. The correct answer is option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. A seizure during venipuncture requires immediate removal of the needle and tourniquet to prevent injury. The patient should be protected from surrounding hazards and medical help should be called. Restraining the patient or placing objects in the mouth can cause harm. Question 35. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A. Informed consent. Option B. Expressed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 36. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A. Informed consent. Option B. Implied consent. Option C. Verbal consent. Option D. Statutory consent. The correct answer is option A. Informed consent. Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 37. Which of the following factors can cause a false decrease in a patient's serum glucose measurement? Option A. Separating the serum from the red blood cells within 30 minutes of collection. Option B. Leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Option C. Transporting the specimen to the laboratory on an ice slurry. Option D. Utilizing a gray top tube containing sodium fluoride to collect the sample. The correct answer is option B. Leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Glucose can fall falsely when an uncentrifuged specimen sits at room temperature because cells continue to metabolize glucose. This ongoing glycolysis lowers the measured concentration over time. Prompt separation or collection in a fluoride-containing tube helps prevent the decrease. Question 38. What type of vessel carries oxygenated blood away from the heart to the systemic tissues? Option A, artery. Option B, vein. Option C, capillary. Option D, venule. The correct answer is option A, artery. Systemic arteries carry oxygenated blood away from the heart to body tissues. They operate under higher pressure and have thicker walls than veins. The pulmonary artery is an exception because it carries deoxygenated blood to the lungs. Question 39. Which of the following infections is considered the most common nosocomial risk for healthcare workers handling blood? Option A, human immunodeficiency virus, HIV. Option B, hepatitis B virus, HBV. Option C, tuberculosis, TB. Option D, malaria. The correct answer is option B, hepatitis B virus, HBV. Hepatitis B has historically been a major occupational concern for workers exposed to blood because it is efficiently transmitted by percutaneous injury. Vaccination reduces risk, but exposure prevention remains essential. HIV, tuberculosis, and malaria require appropriate precautions, yet they are not the most common blood-handling nosocomial risk in this context. Question 40. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C, document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 41. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A, cryoglobulins. Option B, ammonia. Option C, lactic acid. Option D, free fatty acids. The correct answer is option A, cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 42. Which of the following options defines the proper order of draw for a blood culture, a lavender tube, and a gold SST tube? Option A, blood culture, gold SST, lavender. Option B, gold SST, lavender, blood culture. Option C, lavender, blood culture, gold SST. Option D, blood culture, lavender, gold SST. The correct answer is option A, blood culture, gold SST, lavender. Blood cultures are collected first, followed by serum tubes such as gold SST, and lavender EDTA tubes later. This sequence protects culture sterility and reduces additive carryover. Drawing EDTA before serum can contaminate later specimens with anticoagulant. Question 43. What type of collection is performed to screen for hidden blood in a stool specimen? Option A, occult blood test, GWAC. Option B, culture and sensitivity, C&S. Option C, DOVA and parasites, O&P. Option D, fecal fat quantification. The correct answer is option A, occult blood test, GWAC. An occult blood test, often using a GWAC method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, ova and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 44. Chain of custody protocols are required for which type of laboratory specimens? Option A, fruitine lipid panels. Option B, therapeutic drug monitoring. Option C, paternity and forensic drug testing. Option D, blood cultures for sepsis. The correct answer is option C, paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 45. Which of the following tests is typically ordered to detect systemic blood infections or septicemia? Option A, complete blood count, CBC. Option B, blood cultures. Option C, erythrocyte sedimentation rate, ESR. Option D, C-reactive protein, CRP. The correct answer is option B, blood cultures. Blood cultures are ordered to detect microorganisms circulating in the bloodstream. They are essential when septicemia or bloodstream infection is suspected. CBC, ESR, and CRP can support infection assessment but do not identify organisms in blood. Question 46. Which of the following practices is an example of an engineering control to prevent bloodborne pathogen exposure? Option A, wearing a face shield when opening specimen tubes. Option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Option C, washing hands with antimicrobial soap for 20 seconds. Option D, following a strict order of draw sequence. The correct answer is option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Sharps containers with safe openings and safety needle shields are engineering controls because they isolate or remove the hazard by design. These devices reduce needle stick risk during and after collection. Gloves and training are important but do not physically engineer the hazard away. Question 47. What is the correct protocol for mixing an additive tube after filling? Option A, shake it vigorously up and down 5 times. Option B, roll it back and forth between your palms for 30 seconds. Option C, invert it gently back and forth the recommended number of times. Option D, let it sit completely still in a rack to mix naturally. The correct answer is option C, invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 48. What is the clinical term for an increase in the total number of circulating red blood cells? Option A, anemia. Option B, polycythemia. Option C, leukemia. Option D, thrombocytopenia. The correct answer is option B, polycythemia. Polycythemia means an increased total number of circulating red blood cells or increased red cell mass. It can thicken blood and increase thrombotic risk depending on cause. Anemia is decreased red cell or hemoglobin concentration. Question 49. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A, it breaks the vacuum seal of the multisample tube. Option B, it can cause permanent damage to underlying nerves and blood vessels. Option C, it dulls the needle tip and makes skin entry painful. Option D, it causes the patient's blood pressure to spike excessively. The correct answer is option B, it can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 50. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A, an N95 respirator mask and shoe covers. Option B, a standard surgical mask and gloves. Option C, a full body Tyvek suit and goggles. Option D, no personal protective equipment is required. The correct answer is option B, a standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 51. What is the clinical term for a state of fainting or temporary loss of consciousness caused by a sudden drop in blood pressure? Option A, syncope. Option B, shock. Option C, vertigo. Option D, hemastasis. The correct answer is option A, syncope. Syncope is a temporary loss of consciousness caused by reduced blood flow to the brain, often from a sudden blood pressure drop. It may occur during venipuncture due to anxiety, pain, fasting, or vasovagal response. Shock and vertigo are different clinical conditions. Question 52. What is the primary clinical reason for wiping away the first drop of blood during a capillary skin puncture? Option A, to eliminate surface bacterial contamination from the skin. Option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. Option C, to prevent the blood from clotting too quickly in the microcollection tube. Option D, to ensure that the blood flow is adequate for collection. The correct answer is option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. The first drop from a capillary puncture is wiped away because it can contain tissue fluid and activated clotting material. Removing it improves sample concentration and reduces microclot risk. Excessive squeezing after the puncture can reintroduce tissue fluid contamination. Question 53. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A, draw the blood quietly without waking them up to minimize pain. Option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C, skip the patient and mark them as unavailable on the computer. Option D, ask the patient's roommate to confirm their identity for you. The correct answer is option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 54. Which of the following elements is a key component of quality control in a point-of-care testing? POCT program. Option A, documenting the daily temperature of the laboratory refrigerator. Option B, verifying that the patient's insurance information is updated. Option C, running electronic or liquid controls according to manufacturer and facility guidelines. Option D, cleaning the outpatient waiting room chairs with bleach solution. The correct answer is option C, running electronic or liquid controls according to manufacturer and facility guidelines. POCT quality control includes running electronic or liquid controls according to manufacturer instructions and facility policy. Controls verify that the device, reagents, and operator process are producing reliable results. Patient testing without required QC can lead to inaccurate bedside decisions. Question 55. What type of fire hazard is represented by the red quadrant of the NFPA 704 diamond? Option A, flammability hazard. Option B, health hazard. Option C, reactivity hazard. Option D, specific hazard. The correct answer is option A, flammability hazard. The red quadrant of the NFPA 704 diamond indicates flammability hazard. It communicates how readily a material can ignite. Blue represents health, yellow represents instability, and white indicates special hazard information. Question 56. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A, transporting the specimen to the laboratory on ice. Option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C, using a green top tube containing sodium heparin. Option D, labeling the specimen tube at the patient's bedside. The correct answer is option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 57. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A, routine cholesterol screen. Option B, workplace drug testing. Option C, blood culture for endocarditis. Option D, complete blood count for anemia. The correct answer is option B, workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 58. What is the standard ratio of blood to anticoagulant additive in a green top tube? Option A, 9:1. Option B, 4:1. Option C, there is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Option D, 1:1. The correct answer is option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Green top heparin tubes do not depend on a strict blood-to-additive ratio like light blue citrate tubes. The tube should still be filled adequately and mixed gently so enough heparin is present to prevent clotting. Coagulation citrate specimens are the classic ratio-sensitive collection. Question 59. What is the clinical term for a localized infection or inflammation of the bone caused by accidental needle striking during a heel stick? Option A, osteosarcoma. Option B, osteomyelitis. Option C, osteoarthritis. Option D, osteopenia. The correct answer is option B, osteomyelitis. Osteomyelitis is infection or inflammation of bone. In heel puncture, it can occur if the lancet penetrates too deeply and injures the calcaneus. Proper site choice and maximum depth limits are used to prevent this serious complication. Question 60. How should a phlebotomist approach a child who needs a blood test? Option A, tell them it will not hurt at all to gain their trust. Option B, explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C, have 3 guards hold them down before introducing yourself. Option D, show them the largest needle to prove how brave they need to be. The correct answer is option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 61. Which of the following tests is used to evaluate the extrinsic pathway of the coagulation cascade? Option A, activated partial thromboplastin time, APTT. Option B, bleeding time test. Option C, prothrombin time / international normalized ratio, patient / INR. Option D, complete blood count, CBC. The correct answer is option C, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic and common coagulation pathways. They are commonly used to monitor warfarin therapy and assess clotting factor activity. APTT primarily evaluates the intrinsic pathway, and CBC measures cells rather than coagulation pathway function. Question 62. What color top tube contains the additive sodium citrate and is used for coagulation profiles? Option A, light blue top. Option B, lavender top. Option C, green top. Option D, gray top. The correct answer is option A, light blue top. Light blue tubes contain sodium citrate and are used for coagulation profiles. Citrate binds calcium reversibly and preserves clotting factors for testing when the tube is properly filled. Other tube colors contain additives that can interfere with coagulation assays. Question 63. Which of the following actions can lead to a false elevation in a patient's serum potassium level? Option A, releasing the tourniquet within 1 minute of needle insertion. Option B, keeping the patient's arm down during the venipuncture procedure. Option C, allowing the patient to pump their fist repeatedly before and during the draw. Option D, transporting the specimen to the laboratory within 30 minutes. The correct answer is option C, allowing the patient to pump their fist repeatedly before and during the draw. Repeated fist pumping can falsely elevate serum potassium by promoting local muscle activity and hemoconcentration. Potassium may shift out of cells or become concentrated in the specimen. A relaxed fist without pumping is preferred during routine venipuncture. Question 64. Which of the following tubes contains an additive that prevents clotting by activating antithrombins? Option A, light blue top, sodium citrate. Option B, green top, heparin. Option C, lavender top, EDTA. Option D, gray top, potassium oxalate. The correct answer is option B, green top, heparin. Heparin prevents clotting by activating antithrombin, which inhibits thrombin and other clotting factors. Green top tubes use this mechanism for plasma chemistry and selected special tests. EDTA and citrate work by binding calcium rather than activating antithrombin. Question 65. Which of the following is an example of an analytical component of quality assurance? Option A, double-checking patient identity wristbands. Option B, ensuring proper maintenance and calibration of automated laboratory equipment. Option C, delivering critical panic results to a physician on time. Option D, labeling the collection tubes at the bedside. The correct answer is option B, ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 66. Which of the following tubes contains an additive that preserves glucose levels for up to 3 days? Option A, gray top, sodium fluoride. Option B, light blue top. Option C, lavender top. Option D, green top. The correct answer is option A, gray top, sodium fluoride. Gray tubes containing sodium fluoride preserve glucose by inhibiting glycolysis for an extended period. This helps maintain glucose concentration when processing may be delayed. Other tube types do not provide the same glucose stabilizing additive. Question 67. What type of mask is required when entering a room designated for droplet precautions? Option A certified N95 respirator mask. Option B, a standard fluid-resistant surgical mask. Option C, a cloth face covering or scarf. Option D, no mask is required if you stay 2 feet away from the bed. The correct answer is option B, a standard fluid-resistant surgical mask. Droplet precautions require a standard fluid-resistant surgical mask when entering the patient's room or working close to the patient. The mask blocks larger respiratory droplets from reaching mucous membranes. N95 respirators are used for airborne precautions, not routine droplet isolation. Question 68. What is the clinical name for the stoppage of bleeding from a damaged blood vessel? Option A, hemostasis. Option B, homeostasis. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option A, hemostasis. Hemostasis is the process that stops bleeding after vessel injury. It involves vascular constriction, platelet plug formation, and coagulation. Homeostasis is broader internal balance, while hemolysis and hemoconcentration are specimen or blood changes. Question 69. What is the primary function of leukocytes? Option A, carrying oxygen to body tissues. Option B, preventing blood loss through clotting. Option C, defending the body against foreign pathogens. Option D, maintaining osmotic pressure in the plasma. The correct answer is option C, defending the body against foreign pathogens. Leukocytes are white blood cells that defend against infection and foreign material. They include several cell types involved in immune response, inflammation, and pathogen destruction. Red cells transport oxygen, platelets support clotting, and plasma proteins help maintain fluid balance. Question 70. Which of the following conditions can cause a specimen to be rejected due to icterus? Option A, falsely high fats in the patient's diet. Option B, high concentrations of bilirubin in the serum or plasma sample. Option C, excessive destruction of red cells inside the tube due to rough handling. Option D, utilizing the wrong color top tube during collection. The correct answer is option B, high concentrations of bilirubin in the serum or plasma sample. Icterus describes a yellow to amber serum or plasma appearance caused by high bilirubin concentration. It can interfere with certain laboratory methods and may lead to rejection or result comments depending on severity. Lipemia and hemolysis create cloudy or red appearances rather than bilirubin-related discoloration. Question 71. Which of the following veins is located on the medial, inner, aspect of the antecubital fossa and is close to the brachial artery? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, radial vein. The correct answer is option B, basilic vein. The basilic vein is located medially on the inner side of the antecubital area. It lies closer to the brachial artery and median nerve than the preferred veins. This anatomical relationship is why it is usually avoided unless necessary. Question 72. What clinical condition is characterized by fluid accumulation in the intercellular tissue spaces, making the arm swollen? Option A, lymphedema or edema. Option B, petechiae. Option C, sclerosis. Option D, hematoma. The correct answer is option A, lymphedema or edema. Lymphedema or edema describes swelling from fluid accumulation in intercellular tissue spaces. It may occur after lymph node removal, obstruction, injury, or other circulation problems. Drawing from a swollen limb can be difficult and may produce unreliable specimens. Question 73. Why is a royal blue top tube used for trace element and toxicology testing? Option A. The tube contains a unique fast-acting liquid anticoagulant. Option B. The tube stoppers are specially manufactured to be free of trace element contamination. Option C. The tube is thicker to resist breaking in specialized centrifuges. Option D. The tube completely blocks out all infrared and UV rays. The correct answer is option B. The tube stoppers are specially manufactured to be free of trace element contamination. Royal blue tubes are manufactured to minimize trace element contamination from stoppers, glass, plastic, and additives. This is essential for toxicology and trace metal testing where very small contamination can alter results. The color does not mainly indicate light protection or faster anticoagulation. Question 74. What type of consent is assumed when an emergency department patient is unconscious and requires immediate life-saving laboratory work? Option A, expressed consent. Option B, informed consent. Option C, implied consent. Option D, verbal consent. The correct answer is option C, implied consent. Emergency implied consent applies when an unconscious patient needs immediate life-saving care and cannot provide permission. Necessary laboratory work may proceed under facility policy to support urgent treatment. This differs from routine outpatient cooperation or signed informed consent. Question 75. What is the primary medical reason for avoiding dermal punctures on the heel of an infant who has begun walking? Option A. The skin has developed calluses that block capillary action flow. Option B. The child's heel bone is too small to locate accurately. Option C. Walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Option D. Walking diverts all white blood cells up toward the abdominal cavity. The correct answer is option C. Walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Once an infant begins walking, heel tissue becomes thicker and more calloused and is more vulnerable to deep tissue irritation. Heel puncture at that stage can be painful and less reliable for capillary sampling. Finger puncture or another approved method is used according to age and policy. Question 76. Which of the following parameters is evaluated when performing a basic metabolic panel, BMP? Option A, hemoglobin and hematocrit levels. Option B, the electrolytes, blood urea nitrogen, creatinine, and glucose. Option C, coagulation factor levels and platelet function. Option D, bacterial growth over a 48-hour incubation period. The correct answer is option B, electrolytes, blood urea nitrogen, creatinine, and glucose. A basic metabolic panel evaluates electrolytes, glucose, blood urea nitrogen, creatinine, and related chemistry values. It is used to assess kidney function, acid-base status, and metabolic balance. Liver enzymes, cardiac markers, and hematology counts belong to other panels or departments. Question 77. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A. The posterior curvature of the heel directly over the calcaneus bone. Option B. The medial or lateral margins of the plantar surface of the heel. Option C. The central arch area of the foot pad. Option D. The tips of the smaller toes. The correct answer is option B. The medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 78. How many times should a light blue top tube be inverted immediately after collection? Option F 1 to 2 times. Option B 3 to 4 times. Option C 5 to 8 times. Option D 10 to 12 times. The correct answer is option B 3 to 4 times. Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 79. Which of the following practices helps ensure compliance with standard precautions in phlebotomy? Option A. Wearing gloves during all vascular access procedures and changing them between patients. Option B. Reusing plastic tube holders as long as no blood is visible on the outside surface. Option C. Washing disposable nitrile gloves with soap and water to extend their use. Option D. Placing used lancets into regular trash cans if they look clean. The correct answer is option A. Wearing gloves during all vascular access procedures and changing them between patients. Standard precautions require gloves for vascular access and glove changes between patients. This treats all blood and body fluids as potentially infectious regardless of known diagnosis. Reusing holders, washing disposable gloves, or discarding sharps in regular trash violates safe practice. Question 80. What tube additive prevents clotting by binding or chelating calcium? Option A. Lithium heparin. Option B. DDTA. Option C. Sodium polyethylene sulfonate. Option D. Thrombin. The correct answer is option B. EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 81. What does the term phlebotomy literally mean in Greek? Option A. To clear a blood clot. Option B. To measure blood cells. Option C. To cut into a vein. Option D. To study circulating fluids. The correct answer is option C. To cut into a vein. The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 82. What is the maximum acceptable delay time for separating serum or plasma from cells for most routine chemistry tests? Option A. 30 minutes. Option B. 2 hours. Option C. 4 hours. Option D. 8 hours. The correct answer is option B. 2 hours. For many routine chemistry tests, serum or plasma should be separated from cells within about 2 hours. Delayed separation allows cells to consume glucose and release or exchange analytes. Excessive delay can produce inaccurate results even if the collection itself was successful. Question 83. Which of the following additives is found in a grey top tube and works by precipitating calcium to prevent clotting? Option A. Potassium oxalate. Option B. Sodium citrate. Option C. Lithium heparin. Option D. DDTA. The correct answer is option A. Potassium oxalate. Potassium oxalate prevents clotting by precipitating calcium, making calcium unavailable for the coagulation cascade. It is commonly paired with sodium fluoride in gray tubes. Citrate and EDTA bind calcium differently, while heparin works through antithrombin. Question 84. What is the function of the systemic circulatory system? Option A, moving blood exclusively between the heart and the lungs for gas exchange. Option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C, filtering liquid waste products through the nephron beds of the kidneys. Option D, producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 85. Which of the following factors can cause a specimen to become hemolyzed during processing? Option A, allowing a serum separator tube to clot completely before centrifugation. Option B, balancing the centrifuge correctly with tubes of equal volume. Option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Option D, keeping a plasma specimen chilled on an ice slurry. The correct answer is option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Centrifuging a specimen before it clots completely or spinning too aggressively can rupture cells. This processing-related hemolysis can make serum or plasma red and alter analytes. Proper clot time and centrifuge settings help prevent specimen damage. Question 86. What should a phlebotomist do if they note that a light blue top tube did not fill completely due to a loss of vacuum during a draw? Option A, use the partial sample anyway and send it to the lab. Option B, discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. Option C, pour blood from a green top tube into the light blue tube to top it off. Option D, shake the tube vigorously to force the remaining air out. The correct answer is option B, discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. An underfilled light blue tube must be discarded and recollected because the 9:1 blood to citrate ratio is no longer valid. Sending the partial tube may produce falsely prolonged coagulation results. Transferring blood between tubes or shaking the tube cannot restore the required ratio. Question 87. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A, green top. Option B, light blue top. Option C, lavender top. Option D, yellow top. The correct answer is option A, green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 88. Which of the following tests is used to monitor a patient's heparin therapy? Option A, prothrombin time, patient. Option B, activated partial thromboplastin time, APTT. Option C, hemoglobin A1c. Option D, rheumatoid factor, RF. The correct answer is option B, activated partial thromboplastin time, APTT. APTT evaluates the intrinsic pathway and is commonly used to monitor unfractionated heparin therapy. Heparin affects clotting factors measured by this pathway. Patient is more associated with warfarin monitoring, while HbA1c and rheumatoid factor are unrelated to heparin dosing. Question 89. Which of the following is a primary duty of a phlebotomist regarding quality assurance? Option A, interpreting abnormal lab results for patients. Option B, ensuring specimen tubes are collected, labeled, and transported correctly. Option C, changing medication doses based on therapeutic levels. Option D, performing complex tissue biopsies in the operating room. The correct answer is option B, ensuring specimen tubes are collected, labeled, and transported correctly. Phlebotomy quality assurance focuses on collecting, labeling, handling, and transporting specimens properly. These pre-analytical steps have a major impact on result accuracy. Interpreting results, changing medication doses, or performing biopsies is outside the phlebotomist's usual role. Question 90. Which of the following additives is found in a green top tube and works by inhibiting the action of thrombin in the clotting process? Option A, sodium citrate. Option B, DDTA. Option C, heparin, lithium, ammonium, or sodium. Option D, potassium oxalate. The correct answer is option C, heparin, lithium, ammonium, or sodium. Green top tubes contain heparin, which prevents clotting by enhancing antithrombin activity and inhibiting thrombin. Lithium, sodium, and ammonium heparin are selected based on test requirements. Citrate, EDTA, and oxalate prevent clotting by binding or precipitating calcium. Question 91. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 92. Which of the following factors is a major cause of specimen rejection in the laboratory? Option A, collecting a lavender top tube for a CBC test. Option B, submitting an underfilled light blue coagulation tube. Option C, delivering a chemistry specimen to the lab within 4 to 5 minutes. Option D, affixing a handwritten label over a pre-printed barcode label. The correct answer is option B, submitting an underfilled light blue coagulation tube. Underfilled light blue coagulation tubes are a common cause of specimen rejection because the blood-to-citrate ratio is invalid. Excess citrate can alter clotting times and make results unreliable. Proper tube fill is more critical for citrate tubes than for many serum or EDTA tubes. Question 93. What type of vessel links the arterial system directly to the capillary network paths? Option A, arteriole. Option B, venule. Option C, vena cava. Option D, deep vein. The correct answer is option A, arteriole. Arterioles connect arteries to capillary beds and regulate blood flow into tissues. Their muscular walls can constrict or dilate to control local perfusion. Venules drain capillaries, and lymph ducts carry lymph rather than arterial blood. Question 94. What should a phlebotomist do if a patient experiences a sudden, sharp, shooting pain down their arm during a venipuncture? Option A, advance the needle deeper to see if the pain stops. Option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Option C, tell the patient that minor discomfort is completely normal for this vein. Option D, instruct the patient to keep their arm completely still while you finish filling the tube. The correct answer is option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Sudden sharp shooting pain down the arm suggests possible nerve contact. The venipuncture should be terminated immediately, the needle withdrawn, and the patient assessed according to policy. Continuing or redirecting the needle can worsen nerve injury. Question 95. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A, basic metabolic panel, BMP. Option B, forensic drug analysis or paternity testing. Option C, therapeutic drug monitoring for digoxin. Option D, blood culture tracking for endocarditis. The correct answer is option B, forensic drug analysis or paternity testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures. Question 96. Which of the following conditions is characterized by a dangerous drop in blood volume, causing pale skin, rapid pulse, and hyperventilation? Option A, hypovolemic shock. Option B, septic shock. Option C, anaphylactic shock. Option D, cardiogenic shock. The correct answer is option A, hypovolemic shock. Hypovolemic shock results from dangerously reduced circulating blood volume. Signs may include pale cool skin, rapid pulse, low blood pressure, anxiety, and hyperventilation. Septic, anaphylactic, and cardiogenic shock arise from different mechanisms. Question 97. Which of the following elements can cause a falsely elevated calcium level during a venipuncture? Option A, prolonged tourniquet application past 2 minutes. Option B, chilling the specimen on an ice slurry. Option C, using a 21-gauge needle on a large vein. Option D, failing to wipe away the first drop of blood during a fingerstick. The correct answer is option A, prolonged tourniquet application past 2 minutes. Prolonged tourniquet application can concentrate proteins and protein-bound analytes, including calcium. This may create falsely elevated calcium results. Chilling, normal needle size, or capillary first drop handling do not cause the same venous stasis effect. Question 98. Which of the following parameters must be strictly managed when collecting an arterial blood gas (ABG) sample? Option A, protecting the syringe from exposure to direct light sources. Option B, ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. Option C, inverting the syringe 20 times to mix the clot activator. Option D, using a gray top tube to transport the arterial blood. The correct answer is option B, ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. ABG specimens are time-sensitive because blood gases and pH can change after collection. The sample must be transported and analyzed promptly according to facility requirements. Delays, air bubbles, or improper temperature handling can distort oxygen, carbon dioxide, and pH values. Question 99. What should a phlebotomist do if they encounter a patient who does not speak the same language as the healthcare provider? Option A, use hand gestures to explain the invasive procedure and proceed with the draw. Option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Option C, ask the patient's roommate to translate the instructions for you. Option D, cancel the test order and document the patient as uncooperative. The correct answer is option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Certified medical interpreters ensure that the patient receives accurate information and can provide meaningful consent. Family members or untrained staff may omit, alter, or misunderstand medical details. Clear communication is essential for safety, cooperation, and legal compliance. Question 100. What type of transmission occurs when an infectious agent is spread through contaminated food, water, or drugs? Option A, vehicle-borne transmission. Option B, vector-borne transmission. Option C, airborne transmission. Option D, direct contact transmission. The correct answer is option A, vehicle-borne transmission. Vehicle-borne transmission occurs through contaminated food, water, drugs, or other shared substances. The infectious agent is carried by a non-living medium to the host. Vector-borne transmission involves living carriers such as mosquitoes or ticks.